Health insurance after you retire. Today's presentation, we will cover which health and welfare benefits continue into retirement, eligibility for UC retiree health, UC retiree health premiums, Medicare and your UC-sponsored medical plan, and at the end, I'll give you some tools and resources. So which benefits continue when you retire? Here's a list of the benefits that will continue and those that will end when you separate from the university. Your medical, dental, and legal plans, those will continue if you're eligible to continue health benefits when you retire, and the premiums are deducted from your monthly retirement income. When it comes to the vision benefits, you may continue your vision plan, but you must contact VSP directly and pay your full premium directly to VSP. Disability coverage ends. That will end on the last day you're actively at work or on pay status. Life insurance, that ends as well. You may convert it to an individual policy within 31 days of your separation date. The health FSA and debt care FSA, that coverage ends as well. You may elect the health FSA through COBRA if you still have funds in your account. AD&D, you can continue. You must enroll and pay the premium directly to Prudential. The auto home insurance, you may continue and pay direct to California Casualty or Farmers Insurance. And pet insurance, you may continue that benefit as well. You pay the premium directly to Nationwide. For UC retiree health eligibility, there are currently 3 eligibility groups. In Group 1, that's for those who were hired before January 1st, 1990. If your original UCRP entry date was prior to January 1st, 1990, and you have not had a break in service, you'll be eligible for 100% of the UC contribution towards your medical and dental plans. To receive the maximum contribution, you had to retire before age 55 with at least 10 years of UCRP service credit, or after the age of 55 with 5 or more years of UCRP service credit. For Group 2, that's for those who were hired or rehired between January 1st, 1990 and June 30th, 2013. The UC contribution toward medical and/or dental plan premiums are based on your UCRP service credit. You must have a minimum of 10 years of UCRP service credit, or your age plus your service credit must equal 75 or more. Every year after your 10th year, you receive an additional 5% toward your UC contribution until you have 20 or more years of service where you reach 100%. To receive 100% of the maximum contribution, you must be at least age 50 or older and have at least 20 or more years of service credit. For Group 3, that's for those who are hired or rehired on or after July 1st, 2013. UC's contribution is based on your age and years of UCRP service credit when you retire. You must have a minimum of 10 years of UCRP service credit to qualify for UC's medical or dental coverage when you retire. You get 100% at age 65 or older and have at least 20 years of service credit. In this example, on the bottom spreadsheet, you will see at 20 or more years of service, age 65 is when you receive 100% of the UC contribution. If your service credit is anything less than 20 years or you're younger than age 65, just use this grid to find out what the contribution will be for you. Those who retire at age 55 are eligible to enroll in UC-sponsored health insurance, but will not receive a UC contribution. To be eligible for UC's health benefits when you retire, you must elect the monthly retirement income option. You must retire within 120 days of terminating your UC employment, and you must have continuous insurance coverage. If you elect the lump sum cash out option, you forfeit your option to continue health insurance. When it comes to separation and retirement date, there is a difference between the two. Your separation date is the last date of employment or the last day you're on pay status, whether you're physically at work, using a vacation day or a sick day. The last day on pay status is your separation date. Your retirement date is the date you want to start receiving your UCRP monthly retirement income. Your separation date and retirement date cannot be the same date. In this example, I'm just showing you that if you separate from UC and elect retirement, your coverage as an employee will end on the last day of the following month that you separate. So for example, if you were to separate on December 31st, 2021, and your retirement date was July 1st, 2022, your coverage will end on January 31st, 2022. But if you were to separate from UC and do not elect retirement, your coverage as an employee will end on the last day of the month that you separate. So if you were to separate on December 31st, 2021, your coverage will also end on December 31st. When it comes to retiree health premiums, as an employee, we all know that your premiums are based on your salary pay band. But for retiree health premiums, they're based on your years of UCRP service credit, and it's based on whole years. So for example, if you had 16.9 years of service credit, UC is going to base your premium on 16 years of service. They always round down, not up. Here's an example of a family of two, self plus adult, highlighted in yellow, that's enrolled in UC Care as an employee. So for this family in pay band 2, they would pay $445.42 for a family of 2. If the same family of 2 was to retire and not eligible for Medicare, they would go from paying $445.42 to paying $706.84. Here's the breakdown. In this example, someone who worked 20 or more years of service, they're eligible for 100% of the UC contribution. The family of 2 for UC Care, the premium is $2,434.15. The maximum UC contribution is $1,727.31. Because they earned 100%, UC is going to pay 100%. The difference between the two is $706.84. Now, if this same family of 2 was to be eligible for Medicare, that's MM, Medicare eligible retiree, and Medicare eligible adult. Now the premium is $899.70. The maximum UC contribution is $624.34. The difference between the two is $275.36. In this example, I'm showing you the difference between someone who works 20 years versus someone who only works 10 years. If you only work 10 years, you're eligible for 50%. So the same family of 2, where the premium is $2,434.15, the maximum is $1,727.31. Well, UC is now only going to pay 50% of the maximum. So the difference between the two is $1,570.49. If they were eligible for Medicare, they're going to pay 50% of the maximum, the difference between the two, is $587.53. You can find the calculator located on our website. Just log on and check the plan that you're in and the family members that you have covered, and that's how you can determine what you will pay when you retire. For dental premiums, it works the same way. If you have 20 or more years of service, UC will pay 100%. Here, the premium is $91.87. UC pays the full premium, therefore you have no premium for dental plan. If you only work 10 years, eligible for a 50%, UC will pay $45.94. Your premium will be $45.93. When it comes to the vision plan, as an employee, UC paid the full premium, but as a retiree, every retiree, regardless of the number of years they work, will pay the full vision plan premium. So keeping with my same example, family of two, they would pay $21.03 to continue their vision plan. Medical plan options depends on where you live when you retire. So if you retire and you stay within the state of California, these are your medical plan options. If you were to retire and move to a state outside of California, these are your medical plan options. Keep in mind, though, that if you are living out of state and all family members become eligible for Medicare, you will then have your benefits go through VIABENEFITS, which is UC's Medicare coordinating program. And I'll go over more of that later. If you retire and live abroad, these are your medical plan options. And you will see here that there are no Medicare plans listed here. And that's because Medicare doesn't cover services outside of the United States. A little bit about Medicare. So what is Medicare? Medicare is a federal program that provides health care coverage for individuals age 65 or older and have earned 40 credits, or sometimes under the age of 65 and disabled, but the disability is determined by Social Security. If you're receiving Social Security disability income for 24 months or more, you could become eligible for Medicare. Or those who were diagnosed with end-stage renal disease, also known as kidney failure, they could become eligible for Medicare. When it comes to Medicare, there are two agencies that are responsible for Medicare. You have Social Security Administration and you have CMS, Centers for Medicare and Medicaid Services. When it's time for you to apply for Medicare for the very first time, you want to contact Social Security. If you want to know what the premium will be that you pay for Medicare, contact Social Security. If you misplace your Medicare card, contact Social Security. But for everything else, you'll be contacting CMS. And that will be for things like whether or not your provider accepts Medicare or what Medicare pays for a particular service. That's when you would contact CMS. There are many parts to Medicare. You have Medicare Part A, Medicare Part B, Medicare Part C, and Part D. Part A covers things like inpatient services, home health, skilled nursing, and hospice care. Part B covers doctor visits, ambulance, lab and x-ray services, physical therapy, preventive care, and durable medical equipment. I'll jump over to Medicare Part D. That's your prescription drug coverage. Your Medicare Part C, an Advantage plan, covers A, B, and D. For 2022, here are the Medicare premiums. Most of us have worked and earned Medicare Part A for free. That's for those who have paid FICA taxes for 10 years and have earned 40 credits. We do not pay a premium for Medicare Part A. But if you are currently not coordinated with Social Security and you have not earned any credits, You have the option to pay for Medicare Part A. It will cost you $499 for Medicare Part A for those who have 0 to 29 credits. If you have 30 to 39 credits, you would pay $274 for Medicare Part A. When it comes to Medicare Part B, everybody pays a premium for Medicare Part A. For those who have higher income, you may pay a little bit more than others for Medicare Part B. The premiums for Medicare Part B are deducted from your Social Security check, and you pay them directly to Social Security if you decide to delay your Social Security. Medicare Part D, most will have a 0 premium, but again, if you have higher income, you may pay for Part D. Just follow this income tax bracket, whether you file an individual or joint tax return, carried over to the right, and that's what you would pay for Part B and Part D. You pay your Medicare premiums in addition to your UC medical plan premium. Social Security always base your Medicare premium 2 years back. They always look at your income tax filing from 2 years prior. So in 2022, they're looking at 2020 income. To find out how many credits you have, log on to ssa.gov and create your account. You want to do this now rather than later. A good thing to look out for when you log in and create your account is to make sure that your credits are correct and that your employer have filed and reported your income to Social Security correctly. When it comes to Medicare Part D, the Part D is out for outpatient prescription drug coverage, and the Part D subsidizes it. It lowers your medical plan premiums. Outpatient prescription drug benefit is included in all of the UC medical plans that UC offers. There is one plan that doesn't have prescription drug coverage. The prescription drug coverage of UC plans are equivalent or better than the Medicare Part D plans. It is considered credible coverage. The formularies may differ from your non-Medicare plan, so keep that in mind when you're transitioning into Medicare. Enrollment in another Medicare Part D plan may result in loss of UC coverage. You cannot have another Part D plan in addition to your UC Medicare Part D plan. Retirees that become eligible for Medicare must complete a form. When can someone enroll in Medicare? There are 3 different enrollment periods when it comes to enrolling in Medicare. You have your initial enrollment period. That's when you're first eligible for Medicare, typically at the age of 65, and it's a 7-month window. It's 3 months before you age 65, your birthday month that you age 65, and 3 months after your 65th birthday month. Your special enrollment period are for those who delayed your initial enrollment period because you were still working or covered under someone who was still working, and it's an 8-month window. The 8 months starts on the first day of the month that your employee coverage will end. And then you have your general enrollment period. That's for anyone who did not enroll during their initial or special enrollment period. And it's 3 months long. It happens at the same time every year, January 1st through March 31st of each year. Hopefully none of you are ever enrolling during the general enrollment period, because that tells me that you missed your initial enrollment period and you missed your special enrollment period. And more than likely, you'll be subject to penalties. So who are the Medicare experts? I'm a UC representative. I'm telling you what UC requires of you when it comes to Medicare. But when you want to know about your Social Security and Medicare benefits, You want to contact the experts, and that's Social Security Administration, Centers for Medicare and Medicaid Services, or HICAP, Health Insurance Counseling and Advocacy Program. If you're still working and collecting Social Security, Medicare is going to automatically enroll you in Medicare Part A and Part B. So if you plan to continue working and not retiring, make sure you follow the instructions on the back of your Medicare card when they send it to you, so you can delay your enrollment for Part B. Otherwise, they're going to start collecting Medicare Part B out of your Social Security check. And you don't need Medicare Part B if you're covered under UC's medical plans. Now, once you retire, it's not an option. You are required to enroll in Medicare. UC relies on Medicare to offset the cost of insurance. Retirees over the age of 65 without Medicare cost twice as much to insure. Medicare partially reduces the cost, which keeps the UC premiums affordable, which allows UC to continue to fund health benefits for retirees. If you become eligible for Medicare while you're still working and do not plan to retire, you have options when it comes to Medicare Part A and Part B. When it comes to those enrolled in the UC Blue and Gold plan, UC Care, or Core, enrolling in Medicare Part A is optional. Most employees that will continue to work will delay their enrollment into Medicare Part B because they know that they will have to pay for it. When it comes to KAISER members, now KAISER is the only plan that will waive all of your copays if you enroll in Medicare Part A and Part B and pay for Part B. You will let them know that you have Medicare A and B, and then KAISER will waive all of your inpatient copays, office visit copays, and prescription copays. And that sounds like a really good deal, but you want to make sure that it will benefit you. So find out how much Medicare Part B will cost you. If the premium you will pay for Medicare Part B is less than what you would pay out of pocket each month, then yes, it would benefit you to enroll and pay for Part B for KAISER members. But if you rarely go to the doctor and you rarely have out-of-pocket expenses, it would not benefit you to pay for Medicare Part B every single month just to get that benefit. If KAISER members want to know more about that, just contact me and I'll be more than happy to help you. When it comes to the health savings plan, it's incompatible with Medicare. You want to make sure you delay Medicare Part A and Part B. You cannot have any parts of Medicare in order to continue your eligibility in this plan. If you are currently enrolled in the health savings plan and you have already enrolled in Medicare Part B, or you're collecting Social Security, you need to immediately disenroll from this plan. Once you retire, again, enrollment into Medicare is not an option. Everything you need to know about what UC requires of you can be found in the Medicare fact sheet available on UCNet. Retirees and their family members who become eligible for premium-free Medicare Part A must enroll in Medicare Part B if you're in a UC-sponsored medical plan. Now, I say premium-free because we have some individuals that hired on with UC and chose not to pay into Social Security, so they did not earn Medicare Part A for free. So the university says that if you have to pay for Medicare Part A, they are not requiring you to enroll in Medicare Part B. But if you're eligible for Part A for free, you have to enroll in Part B. Failure to comply may result in penalties and permanent loss of UC-sponsored medical coverage, but there are some exceptions. And that's for those who retired prior to July 1, 1991, or for those living abroad. But if you decide to stop paying your Medicare premiums because you're living abroad, which you can do as far as the university is concerned, if you return to the United States and you update your address with UC, UC is going to tell you to go back and apply for Medicare since you're back living in the United States. And at that time, you could be penalized by Social Security for not continuing your enrollment. If you're eligible for Medicare when you retire, there is a form that you must complete to continue your enrollment in your medical plan. Just follow the plan that's listed on the far left to determine which Medicare form you will need to complete here. Those that age into Medicare will be enrolled in the Medicare equivalent plan. Each Medicare eligible family member must complete and sign their own form. Here's a timeline of what to expect once you are retired and eligible for Medicare. In this example, I'm showing you someone that's aging 65 in the month of April. So 90 days prior to their 65th birthday, they will receive a packet from the university. They will have 90 days to contact Social Security, enroll in Medicare, complete their Medicare form that I just went over, sign it, date it, and return it to RAS. If in the month of your 65th birthday month, you do not have your form completed and returned, you will start to be penalized the following month, $419.60 every single month until you or your dependent returns the prescription drug form to the university. You will pay this penalty in addition to your medical plan premium. If you're not eligible for Medicare, make sure you request a denial from Social Security and submit that to RASC. If you're currently collecting Social Security income, you are automatically enrolled in Medicare Part A and B. Social Security will send you your Medicare card in the mail approximately 90 days before your 65th birthday month, and the premiums will be automatically deducted from your Social Security income each month. But if you decide to delay your enrollment or collecting your Social Security income, which many will do that, you just need to make payment arrangements. You can apply in person, but due to the pandemic, some of the Social Security offices are not open. Just contact your local Social Security office to see if they're open. So apply in person, you can enroll online, or you can call Social Security to make payment arrangements. You will need to set up payment arrangements directly with Social Security, and you will pay them on a quarterly basis. Again, if you're not eligible for Medicare, request a denial from Social Security and notify UC. If you did not pay into Social Security nor earned 40 credits elsewhere, if you are currently married, you may qualify under your current spouse, your spouse's work record if they're at least age 62. Now, if you are currently single but was previously married at least 10 years, you may qualify under your former spouse or ex-spouse under their Social Security benefits when they age 62. It's extremely important for you to know what UC requires of you when it comes to Medicare. I highlight the age 62 because many forget that you become eligible under your current spouse or former spouse at the age of 62. Many don't remember until their spouse or ex-spouse age 65, and now they go and apply for Medicare under their spouse or former spouse's work record And now they're hit with a 3-year penalty or more because they should have applied when they first age 62. So again, if you're not eligible under your own work record, you could qualify under a former or current spouse when they age 62. Once you are retired, if you have some family members who are eligible for Medicare and some family members who are not currently eligible for Medicare, you're considered a split or mixed family. We're not going to kick your dependents off the plan. Whichever plan that you're in, your Medicare family members will be in the Medicare plan. So if you are in UC Blue and Gold and you have a Medicare family member, they will be in the UC Medicare Choice PPO. Or if you, the retiree, are eligible for Medicare and you're in KAISER Senior Advantage, your non-Medicare family members will be in KAISER. If you're in Core UC Care, your Medicare family members will be in UC Medicare PPO. Again, the UC Health Savings Plan is not compatible with Medicare. You must choose another plan above to continue your medical plan coverage. Now let's talk about Medicare and HMOs. When it comes to Medicare and HMOs, those are your Medicare Advantage plans. If you have Medicare Part A and B and you're enrolled in an HMO, you must assign your Medicare benefits to your HMO. And this is done by completing a form. They become one plan. Medicare does not work separately from your Advantage plan once you assign them together. Medicare pays a flat monthly fee to your insurance company. Now, here's an example of someone that has KAISER Permanente and transitioning to KAISER Senior Advantage. You'll see here as KAISER Permanente member, the non-Medicare plan, these are the copays, some of the copays that you pay. But once you or your family member ages into Medicare, I've highlighted in red some of the changes. You'll see that inpatient copays remain the same, but your ER copay, your emergency room copay, goes down to $65. The prescription drug premiums, premium copays stay the same. The eyeglass benefit, where it was not covered under KAISER Permanente, you actually get an eyeglass allowance under KAISER Senior Advantage. KAISER Senior Advantage is the only Medicare plan that offers vision benefits already built into the plan. You get a $150 allowance for eyeglasses, lens, contact lens, and frames every 24 months. When it comes to behavioral health, KAISER members get KAISER and Optum Behavioral Health, but KAISER Senior Advantage members, Optum goes away. You have no Optum coverage, but you still have KAISER Behavioral Health coverage. For hearing aids under KAISER, you have a $1,000 allowance. Under KAISER Senior Advantage, you have a $2,500 allowance per ear. So for example, if your hearing aids cost $1,000, UC will pay $1,000 for your hearing aids. Under KAISER Senior Advantage, you get a $2,500 allowance per ear. For acupuncture services, the copay goes up $20, $15 for 24 visits, and it's a combined benefit, combined with chiropractic services. So 24 visits total for both chiropractic and acupuncture combined. Under KAISER Senior Advantage, the copay goes up to $20. The out-of-pocket maximum is listed here. You still have access to target clinics, no authorization necessary, whether you're in KAISER or KAISER Senior Advantage. For KAISER Senior Advantage, starting in 2021, the Fallbrook area was added, and these are the zip codes listed here. Also, Kern County was included for effective 2021. When it comes to Medicare and UC Blue and Gold, I have UC Blue and Gold here. And as Medicare, your Medicare family members age into Medicare, they will switch over to UC Medicare Choice. So again, I've highlighted in red some of the changes. Inpatient copay stay the same, outpatient stays the same, but your ER copay goes down to $65. Your prescription copays remain the same. Office visits the same. Hearing aids, you have 50% up to $2,000, and UC Medicare Choice pays the first $2,000. So if you have a $1,000 hearing aid, because the plan will pay 50% under Blue and Gold up to $2,000, UC Blue and Gold will pay $500, and you will pay $500 of that $1,000 hearing aid. But under the UC Medicare Choice, if that hearing aid costs $1,000, they're going to pay the full $1,000 because you have a $2,000 benefit. Acupuncture services, it's $20 for 24 visits, and it's a combined benefit. But under UC Medicare Choice, it's still $20, but you get 24 visits each benefit, 24 chiropractic benefits, and 24 acupuncture benefits. Telehealth services, under Blue and Gold, you have Babylon. Under UC Medicare Choice, you have Amwell, Doctor on Demand, and Teladoc. Under the Blue and Gold plan, that's an HMO, so you have a primary care physician that you're assigned to, and you have to stay within your assigned medical group. So for example, if you have UC San Diego Health as your primary care provider, your medical group, all of your specialists have to also be within UC San Diego Health. In order to go outside of the UC San Diego system, you have to have an authorization. Now, once you age into Medicare and your family member or you enroll into UC Medicare Choice, it's now open access. It's not an HMO, it's an Advantage PPO plan. So you can go wherever you want. You just want to make sure that your provider accepts Medicare. So for example, you could have a UCSD provider that you see today, you can see a Sharp physician tomorrow, you can go to Scripps, you can go to UCLA, you can go wherever you want, you can go out of state. Just make sure they accept Medicare. The annual out-of-pocket maximum is listed here for each plan. And I've listed some of the other medical plan options listed here. Now let's talk about Medicare and your PPO plans. When it comes to Medicare and PPO plans, you're not assigning your Medicare to your plan like with HMOs. Medicare is actually primary and Anthem Blue Cross is secondary, your supplement plan. You must use Medicare certified providers. And the best way to find out if your provider accepts Medicare is just to ask the provider directly. But if you want a list of Medicare providers, that's again when you contact CMS to get a list of providers close to you, those who accept Medicare. So if you are in CORE or UC Care, if you or your family member ages into Medicare, remember you'll be switching over to the UC Medicare PPO plan. So when you age into Medicare, if you're on CORE or UC Care, this is what your plan will look like. Your deductible is $100. If you have an inpatient stay, days 1 through 60, you have no copay. Days 61 through 90, you pay $70.40 per day. Days 91 or more, you pay 20% of that inpatient stay. When it comes to physician or behavioral health or chiropractic visits, you pay 20% for that visit. If you go to a provider that does not take Medicare, you will pay 20% plus any remaining balance. The prescription copays are listed here. There is no eyeglass benefit in this plan. So if you're enrolled in this plan, you may want to consider enrolling in VSP when you retire. For hearing aids and acupuncture services, these services are not covered by Medicare, but your supplement plan will cover them at 80% and you pay 20%. The annual out-of-pocket maximum is listed here. So even though you're paying this $70.40 per day or you may be hospitalized for a long time and you're paying 20% per day, keep in mind that you have an annual out-of-pocket maximum for medical services. So once you reach this maximum, the plan will pay 100%. Once you reach $7,050 for prescriptions out of pocket, the plan will pay at 100%. Telehealth services, that benefit continues. You can have a visit with doctors or a psychiatrist with a $20 copay. All you have to do is just log on to your smart device. This plan offers worldwide coverage up to 6 months. If you are planning a trip abroad and you find that you will be abroad over 6 months, you must contact RASC and enroll in UC Care or CORE. When it comes to the UC Medicare PPO plan, again, you must use Medicare approved providers. There are exceptions, and that's for services like acupuncture services and hearing aids, behavioral health office visits with licensed providers, including psychiatrists, psychologists, and marriage and family and child counselors. Now, it's ultimately your responsibility to know how your plan works. It's your responsibility to search the evidence of coverage booklet to find out the limitations and exclusions to your plan. The reason I say that is because sometimes you will go to a provider, and I'll use the example of a marriage and family therapist, and many of them do not accept Medicare. They do not participate in Medicare. You have to know that even though they're not a participant in Medicare, that your supplement plan will allow you to continue to see that provider so you have no disruption in those benefits. So know how your plan works. If you need help trying to figure out what's covered, what's not, what are limitations and exclusions, log on to UCNet, review the evidence of coverage. If you still need help, contact your plan directly. Now, I mentioned before about the Medicare and the health savings plan. Again, I can't stress enough that this plan is incompatible with Medicare Parts A and Part B. You cannot have Medicare Part A, and you cannot have Medicare Part B. If you or your family member become eligible for Medicare and you're enrolled in this plan, you must contact UCPath if you're an employee, or contact RASC if you're a retiree, and enroll in a different UC-sponsored medical plan. The member can continue to use their health savings account funds for eligible expenses, but you must stop contributing to your health savings account. If you have a balance at age 65, you may take a distribution and it will be taxed as normal income unless it's used for eligible healthcare expenses. If you use it for healthcare expenses, they are not taxed. Now, this plan is not open to retirees. You must already have this plan as an employee and carry it into retirement in order to stay in this plan. Otherwise, it's not an option. The other plan I wanted to cover is the UC High Option Plan. It is the plan that has the highest premium. Many of our retirees love this plan. They prefer to pay a higher premium every month because many of the services are covered at 100%. Most services, but not all. So for the UC High Option Plan, the deductible is $50. Inpatient services, days 1 through 90, no copay. Days 91 or more, you pay 20% per that inpatient stay. For chiropractic and physician visits, you pay nothing. No copay for office visits for your primary or specialists. Behavioral health or mental health, you pay nothing if they accept Medicare. Otherwise, if they don't accept Medicare, you pay 20%. Your prescription copays are listed here. There's no eyeglass benefit in the high option plan. So if you're in high option, you may want to consider enrolling in VSP. For hearing aids and acupuncture services, they're not covered by Medicare, but your supplement plan will cover 80%. You pay 20%. The annual out-of-pocket maximum is listed here. So again, if you have co-pays to pay, you have a long inpatient stay, once you reach $1,050 in your calendar year, the plan will then pay at 100%. For telehealth services, just contact Live Health Online. For doctor and psychiatrist visits, you have a $20 copay. High Option also offers worldwide coverage up to 6 months. If you find yourself abroad over 6 months, you must enroll in UC Care or Core. Again, you must use Medicare-approved providers, with the exception of acupuncture, hearing aids, outpatient office visits with licensed behavioral health providers, including psychiatrists, psychologists, marriage and family and child therapists. One thing I want to point out is for the High Option plan, this plan is only available during open enrollment when all family members are enrolled in Medicare Part A and B. So if you are covering a family member who is not enrolled in Medicare Part A and B, you cannot enroll in this plan. When it comes to behavioral health services, your behavioral health provider all depends on the plan that you're enrolled in. So find your plan on the left, and this will determine your behavioral health provider on the right. One thing I also like to point out is whether you retire from UC San Diego Health System or the UC San Diego campus side, all UC retirees have access to FSAP, Faculty Staff Assistance Program. This benefit does continue when you retire. They offer free confidential counseling and assessment and referrals for you and your family members within your household. They also offer educational workshops and support groups. All you have to do is call them at 858-534-5523 or log on to Blink to take a look at their workshop offerings. I mentioned before about VIABENEFITS. VIABENEFITS is UC's Medicare coordinating program. Again, it's for retirees living in a state outside of California. Each family member must be enrolled in Medicare. This program offers more choices, value, flexibility, and support. UC will provide an annual contribution for each covered family member under your health reimbursement account. Each covered family member will choose an individual plan that's best for them. For retirees living in California, I mentioned before that you, the retiree, pick the plan, and all of your family members must be in that same plan or the Medicare coordinating plan. But for VIABENEFITS, each family member is an individual and choose their own plan. So you, the retiree, could choose Anthem Blue Cross, while your family member may choose to be enrolled in KAISER if it's available in your area. VIABENEFITS will help you pick the best plan for you. Your health reimbursement contribution is based on your graduated eligibility. So if you work 20 or more years of service, you will receive $3,000 in your health reimbursement account, and each of your Medicare family members will also receive $3,000 in their health reimbursement account. You will use this money to enroll in your supplement and prescription drug plan. If after you pay for your supplement plan and your prescription drug plan, if you still have funds left over, you can reimburse yourself for the Medicare Part B premium that you pay, or you can use it for out-of-pocket prescription copays, or you can decide to keep it in your health reimbursement account and let it carry over to the next year. During open enrollment, if you need to make any changes, like add a family member or change your dental or vision or legal benefits, you must do that by a paper form because VIABENEFITS members are locked out of the open enrollment portal. You cannot make any transactions online through the open enrollment portal. And they do this because they're trying to force you to contact VIABENEFITS. Retirement alone is not a qualifying event to change plans. Opportunities to enroll or change plans is if you have a qualifying event. A qualifying event would be if you're moving outside of your plan service area, if you have a newly eligible dependent, if you get married or have a new domestic partnership, if you're covered under your spouse and they're retiring or quitting their job and you have an involuntary loss of coverage event, or if you enrolled in the UC Health Savings Plan, because as you know, again, this is incompatible with Medicare and there's no Medicare coordinating program. So if you're in this plan and you are aging into Medicare, that's a qualifying event for you to then choose another plan. Other than these qualifying events, open enrollment is your opportunity to change plans. Now, if you are not eligible for UC's health and welfare benefits, here are some other options. Check to see if you qualify for health benefits under another family member. If you are enrolled in Medicare, and make sure you enroll in Medicare when your employee coverage ends. Also, check COBRA and Covered California benefits. You may find that Covered California premiums are much less than COBRA, but keep in mind, if you go with a Covered California plan, your co-pays, out-of-pocket maximum, what's included, excluded could different from what you're used to. Now, if you're planning to retire and you or a family member is age 65 or older, there is a form that you must receive from your retirement counselor, and it's called the Request for Employment Information Form, the CMS L564 form. Make sure you have this form before you or your family member starts the application process for Medicare. If you're planning to retire this July 1st, make sure you do not start applying for Medicare Part A and B until May 1st. Once you receive your Medicare ID card, you must complete the Medicare prescription drug form that I went over earlier and return it to RASC. Nothing is automatic. You must take action when you're aging into Medicare and complete the form that ties into your medical plan. And here I have listed some tools and resources that you may find useful. The first being UCNet. Here's the link to UCNet. If you're not familiar with this website, you really need to get familiar with this website because everything you need to know about UC's health and welfare benefits can be found on this website. That would include things like your annual open enrollment information, evidence of coverage booklets for all of your medical, dental, vision plans, your Medicare fact sheets, your retirement handbook, links to what to do when you leave UC employment. I have listed here retiree medical plan cost and plan comparison, quick reference guide, which Medicare plan is right for you and which medical plan is right for you. The fact sheet for UC retiree health eligibility rules. I've listed CMS, Social Security, and high-cap telephone numbers and websites. I have the Retirement Administration Service Center, also known as RASC. I have their telephone number. So when you get ready to retire, this is the number that you'll need to call. I have UC San Diego Retirement Association listed here. The director is Suzanne Shafi, and her telephone number is here. I am a member. I highly suggest if you're not already a member, that you become a member of the Retirement Association by calling Suzanne.
it gives you a way to stay connected to your UC community. They have so many benefits and offerings and workshops like the one you're listening to now, and workshops on long-term care and financial workshops, and they plan trips and so many things, so many offerings by becoming a member. But just contact the Retirement Association and find out more about the Retirement Association and becoming a member. I've listed the premiums, the membership dues here. Again, VIABENEFITS, I've listed their information here. If you are under the UC San Diego Health side, here's your benefits contact information. If you are a campus-funded employee, your contact numbers are listed here. I'm Debra Wells. I'm the healthcare facilitator. My assistant is Ranisha Roberson. If you ever need to reach us, send us an email to hcfhelp@ucsd.edu or call us at 858-534-9686. And that concludes this presentation. Thank you for joining.